Hello, sir. You can hear us, right?
Yeah. Am I audible?
Yes, sir. You're audible.
Fine.
So I think we'll start. So good evening, everyone who has joined me. A warm welcome to all of our fund faculty for joining us today. So I'm Sean Neville, and I'll be your host for this exciting session. So on behalf of ESIC SIGN, student in the group in neurology, I'm thrilled to invite you all about a webinar series, Voyage through Medicine. So to introduce what SIGN is and what we do, I'll invite the event head, Jalati. So Jalati, please introduce SIGN for all of us.
Okay, so good afternoon, everyone, our respected faculty and our distinguished guest, Dr.Archit Boloor, and my fellow classmates. So as the head of event organization of ESIC SIGN, it gives me immense pleasure to welcome you all and to briefly introduce SIGN, the student interest group in neurology. So SIGN is the official student chapter under American Academy of Neurology, and our purpose is simple yet powerful: to nurture curiosity, to build competence, and to inspire the next generation of neurologists and neuroscience-driven researchers. So at its core, SIGN aims to create a space wherein students can meaningfully engage in neurology, whether through academic activities or mentorships or hands-on exposure or collaborative research. So our objectives involve around cultivating clinical interest, strengthening research skills, and ensuring that students like us get opportunities to observe, learn, and contribute to the evolving field of brain and nervous system science. So, over the past months, our science chapter has been deeply involved in research projects, presentations, and participation in various neurology related conferences. So, these experiences have not only helped our members grow professionally, but also allowed us to represent our institution on academic platforms. So, one of our very impactful initiatives was the Epilepsy Awareness Month campaign. For 30 days, we shared daily educational videos covering different aspects of epilepsy, like its symptoms, myths, lifestyle consideration, and first aid measures. This simple yet consistent effort reached a very wide audience and helped us start conversations that truly matter. So, as we continue to expand our activities, our goal remains the same: to bring neurology closer to the students and students closer to neurology. So thank you, and once again, a warm welcome to you, sir, and to all of you guys today. Thank you.
Thank you, Jalati, for introducing SIGN. So as we all know, today's webinar is very special because we are not discussing a disease, diagnostic algorithm, anything. Instead, we are going on a journey with Dr. Archit Boloor. As Newton has rightly said, if I have seen any further, it's by standing on the shoulders of giants. So the journey that shapes every doctor is filled with challenges, late night ward duties, messy case sheets, tiny but life-changing moments. It's what makes us doctor who we are. So we are truly honored to have with us a renowned clinician, professor, and author, Dr. Archit Boloor, someone who has not only treated patients and saved lives, but also has guided countless medical students through his teachings, and of course his famous books, which we can't live without in medicine postings, that is an insider's guide to clinical medicine. He is widely admired for making medicine feel understandable, relatable, and even fun. So, sir, to tell some introduction about Sir has done his undergrad and postgrad from KMC Manipal, which is one of the leading institute in terms of academics and research in Karnataka. He has also earned the Best Teacher Award almost 5 times in the short span of his first 30 years. He has published 50 plus research articles in international journals like Lancet and Nature, which is a very high impact journals. And he has also guided many students in ICMR STS student projects and is very enthusiastic in involving events with students. He has also served as one of the Southeastern editors for Washington Manual of Medical Therapeutics. So we are so privileged to have him take us through his journey in medicine, from an aspiring student to a successful physician to a best-selling author and an inspiring teacher. So, sir, first we'd like to tell thank you for being with us today. We are so excited to have you address our small community of medical students.
Thank you for having me. And it is nice on this, I think, Saturday evening to interact with this enthusiastic people. So thank you for having me as a part of today's session.
Yes, sir. So, sir, we thought we'll have a informal talk with you. It's not like formal talk. So we thought we'll split it into three sections. That is, first we'll talk about your MBBS days, and then how your post graduation has been, and then about your books and other co-curriculars. So, sir, the first question we all would like to ask you is that when you think of your day one when you stepped into MBBS, what was the thought in your mind? Like, did you feel this was right for you? Did you feel excited? What was going in your mind?
I think way back in 1998, it is. I think somewhere in September 27th, we started our course in Kasturba Medical College, Mangalore. Little did I know what medicine was. We had come from our, PU background, maybe a little of biology that we knew. Nothing more than that of medicine was known. I belong to the first generation of physicians or whatever in my family. So I had no personal interaction with anybody prior to know what medicine would be or something. So it was a new experience there because coming from what fixed curriculum that we had up till the 12th standard, what we had a few fixed topics, fixed curriculum. We knew that, and obviously we had only books and maybe some basic practicals that were there. But here it was different. First year was very, 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 very different because we had cadavers and human physiology, biochemistry coming up. So it's quite different. The topics, the books that we had to read, the enormous subjects that we had. It was a big, big, big change that time when we, if I remember very clearly, those days I think we had only international books which were there, so maybe Cunningham's or Guyton or Harper for biochemistry, huge books, very, very, very big books. So which practically none of us finished reading in our first year. So it was quite a different experience. I may not be able to actually maybe describe how it was, but it was different from what a curriculum-driven 12th was to enormous change that happened when we joined MBBS then. It was different from what is now. Possibly now the curriculum is more defined compared to what it was those times. Those times we had to, there was no fixed curriculum as such. We had the topics, we had the books, and anything and I think from that would have been asked. So it was quite maybe different, difficult, challenging, but I think that's how we learned. All of our generation learned like that.
Yes, sir. So, like many people used to say, like sometimes during their MBBS days, like from first year to final year, there will be one time that they think that this is where I belong, this is where I truly want to be, and I want to continue this journey. So, do you have any such memory, like when you felt that this is where you
Definitely,
belong?
I think our time maybe good students had two options. I think medicine and engineering. I was not so good at maths, so engineering was not my point. So I knew that it was medicine, but then maybe when the clinical posting started from the second year onwards, and then when we had good exposure to clinics, interacting with patients and all those things, that's where we realized that yes, this is where we are supposed to be, and this is how our life is going to be. So one of the branches of medicine, at least, would be continuing clinical medicine. That was very clear. Whether it was medicine or surgery, it was quite till the end, but it was a clinical branch that I was always keen on. Possibly, I was more inclined towards surgery rather than medicine. So, possibly till my end, I was very much inclined in surgery. I was good at surgery as a subject, as well as possibly during the internship also. I was quite good at surgery. I was posted in good units where I did get quite a lot hands-on. But then later, when I switched over to medicine, maybe, I don't know, people still ask, how did you decide on medicine? I don't think so. There was a decision as such. I wanted to be a surgeon. I always wanted to be a surgeon. Surgery is one of my most loved subject that I still have. But maybe I found that I had maybe a fine tremors in my hand those days. It's not there now. I don't know. But then I thought that that would deter my surgical skills. So that was the last moment decision that I take. That if I take up this surgical field, that I may not be able to do surgery. So that's one decision which I took maybe in a span of 2-3 days, that I thought my the fine tremors in my hand would hamper my surgical skill, and that's where I just shifted on to medicine. So both medicine and surgery were very close to me, but then surgery, I always loved surgery. I still love surgery to that extent. So
Yes,
the clinical posting that once we started interacting with the patients, that we realized that this is where we are meant to be, and that's where our life is going to be towards that.
so to add on to that, you have any unforgettable warden postings that shaped your clinical mentor? Any unforgettable patients that stayed with you along this course?
No, the most fascinating thing I think in KMC that we are attached to a government college here, government hospital. That's your Venlock Hospital. Huge patient loads, and we had a lot of patients with a lot of chronic diseases. Many of them were there for months together. Some of them for years together. There have been exam cases for batches together. That's been there. And then we used to know them with the name and with their. We literally knew everything about them by heart because they were exam cases. But then these patients were there in the ward for all the time. And that's where we learned that, yes, the diseases are going to be there. The diseases are, the people have to live with it. We had only way to possibly interact with them, make them feel better, not treat them as cases, exam cases, or this case of stroke, this case of Parkinson's, or something like that. They were more human in them because they didn't have anything else. It was a government hospital there, and they used to just remain there. And uh, each of the patients, be it medicine, surgery, or whatever, we had a large number of patients who had like chronic ulcers and all, and we had to do dressings for days together. So we used to take it as a cumbersome thing. Yeah, we have to do it every day. But then that's how things went on there, that you did get attached to quite a lot of patients there. And yes, obviously, the more important point was the teaching that we had. The great teachers who I was at least exposed to. Surgery, Dr. Sriram Bhatt sir. So our batch was lucky that we used to have regular morning classes where sir used to take clinics bedside. This was just before his first edition of book came out. So he was in the process of getting the book out that time. And that's where we had everyday classes, morning 7 o'clock till 8:30, I think, for almost 6 to 8 months. And anybody interested could attend, and sir would take everything, theory, practicals, instruments, everything. So we had the first-hand experience there where people would teach us with so much of passion. So that was something that went in making to not only take up the field of medicine but also continue teaching, because what is there with you has to go on. It cannot perish with you. There are people with wonderful knowledge, but very few of them who teach it to that level that the others get benefited. So we had a very good, teachers who were there who taught us whatever they learned in their full years of experience. And that's what maybe made me what I am today.
Yes, sir. One more thing is that during our MBBS days, we focus more on books, we study a lot. So it's obvious that we get a burnout. And there are days where some people might think, I can't do this anymore. So did you have any experience like this? And if you had, how did you bounce back? What did you tell to the students who are here?
Yeah, obviously, there's so many subjects, so many, the curriculum that has been vast. There are many subjects that are coming, overlapping subjects. You're just not able to finish. Now, when you're doing surgery, there is already medicine, the exams of medicine coming. So you're neither able to concentrate on surgery, neither able to concentrate on medicine. Your performance in some of the exams become bad. You don't get the marks to that level. You think that you're really good, but then you all of a sudden realize that the paper has been asked and there are questions which come from nowhere. I think in medicine we had a long question on porphyria and none of us knew management of porphyria, and just it's like a 10 marker gone zero. So it was like a lot of such disappointments would happen. But then I think it is a process of learning. Our time was competitive, but not to the level of competition that is there now. But yes, we do have lows, and we have days where we have a lot of success also. What is important for us to understand is that is not the end. I don't think so. I had experienced any major failures of a major side. Okay, maybe some of the sessionals the marks were low, but never went to a level where there was a failure. But yes, what helps most is your friends that have been there, whom you would meet on a regular basis, interact on a regular basis. Many times we would get lesser, some of them would get more. We would learn from each other. And that bond of people that we are remembering, or whom we interact on a regular basis in the college or after the college, hang out with them. That's what keeps you going on. So we had a very good set of people who were there. The localites, or the people who were in and around from Karnataka. So we had quite a large number of people of them. And then anytime anybody required something, I think everybody would pitch in together. The process is long because it's not just 1 year that you have been there. So you have many years and many subjects coming. People would not clear some subjects and had to carry a lot over for the next year. And during their exams, they would not be able to attend the posting and all those things. So others pitched in during that time, helped them. And that's how I think possibly all of us moved through MBBS. Practically, I think this would be the 27th year of MBBS that we have finished, and we are closely lit even today. We interact with WhatsApp groups, and then yearly ones. Quite a large chunk of us meet even now, discuss our successes, our failures, and that's how has it's been going on from then. So your friends group is the most important point. Our times we didn't have that much of teacher mentors. Now we do have a lot of mentors in the form of teachers, where you could go and then interact right from the beginning. They are assigned mentors. Our time we didn't have that much, so it was the student and our support systems which we had, and that's how we moved across. So that still holds good even today. I think with you have a good group of fellows who are maybe 1 year senior to you or 1 year junior to you, and then you interact with them not only academically, even otherwise, and that keeps you going. So that helps a lot, and that's the golden rule of medicine, that how you go through MBBS or afterwards.
Yes, sir. So also, were you involved in any extracurriculars, or were you just a bookworm who would like to read in the room?
I was not very, bookwormish. I was okay. I wouldn't go to libraries and sit and read. Yes, I did read a lot, but then I was into interclass. I was into culturals. I was into singing. So I used to participate in solo or a group singing, and possibly the Antakshari. I think it's a record of sort that I've won for almost 6 years continuously. Still, I stop. Even now, I do. I do engage into that. Cinema has been a very big part of my life. So we would watch at least 3 to 4, 5 cinemas those days. Those times we didn't have big theaters. People, new movies would come into those small LD theaters, unofficial things. So we used to watch at least 3 to 4 movies per a week, possibly. So any language for that matter. So I think I was not a bookworm. I would not consider myself to be a bookworm. But yes, extracurricular, I was very much involved in culturals, and singing was definitely one of the most important thing that I did participate in.
Yes, sir. I think that's a point that some few of us won't be knowing, that you're a great singer. Sir. It's good to know that.
Now, I'm not
Also,
a great
sir,
singer. I'm just a singer, but that's okay. I'm not a great
yes.
singer in any ways.
Sir, also coming to research as such, you have published over 50 articles in Lancet, the Nature, and also you have guided many ICMR STS projects also in your college. So, sir, in your MBBS days, did you have exposure to research, or have you done any research? So, what do you feel when you look back at this point?
I think KMC Mangalore, that's where we did. I think the community medicine department that time, when maybe we were in the third year, somewhere in 2000 or 2001, I think that's when it was compulsory for us as in the community medicine. That's the third year that we had to do a small project. So we had to go to the community, we had to discuss some very simple things, and then we had to make a thesis sort of out of it. Like we had to write the objectives, everything, like what we do a research thesis later. Similar to that, we had to do it, and we had to publish books out of it and submit to the department. So we had exposure to research very early. I think KMC Mangalore is one of the pioneer. I think 2 or 3 years back, this model of undergraduate research, which was started, it has been published in Lancet by the Department of Community Medicine. So we had good exposure to research, and we had very good mentors, both in the community medicine department and a few of them in the clinical side also, who were very willing to help us in research. However, maybe the generation that we were, maybe after 2007 or 8, that's where the undergraduate research really boomed in us, where the ICMR STS, I think initially there was no limit per college. Now there is a limit per
Yes.
college. I think 20 per college is there. From I think 2003, 2004, I think KMC Mangalore had almost 50 students getting it those times. Now we have 20 every year. So there is a good environment that is there in the college, which helped people research, and there were very good faculty also who helped us. And there were workshops which were done on research paper writing. And initially we have attended. Later I was part of the teaching curriculum also, where I was guiding people how to write case reports, how to write articles, how to choose the topic, all those things. And so it's embedded in the curriculum here. It's like you have to do it. And quite a large number of student research projects happen even till date. And the environment that is there, you have available clinical research that is there, you have good mentors and interested students. That's most important. And that's something which collectively forms what is the basis for a good research. The students' time, maybe in the postgraduate time, it is mandatory. We have our thesis. When we did thesis and all, it was pretty, it all depended upon your guide. Guide wanted some topic and we had to do that. So my thesis inclusive of that, we had to do such things. So which we were not be actually interested in. It did never get published. So it was like very, very dogmatic topics were there, which obviously when we see retrospectively 20 years down the line, we see what sort of thesis we did. But then later on, I think the trend went towards that whatever studies that we do need to be published. So that sort of insight came in. So the topics that were selected, what we are selecting now, we do look into topics which are more publishable, more relevant for practice, and that's how we go ahead. We have a lot of research workshops that happen and mentorship that's happening. So we have groups where people who are interested in research can come and then they can discuss their projects, take the feedback, and then improve on that. So research has been there in KMC Mangalore from more than 25 years now. And lucky that I was part of, from the initial part only, we have been part till now. I am also part of the research grant workshop, the vertical which is there, which takes care or helps people to refine their research. So important is it's primarily driven by the student. So it's an undergraduate student who is interested, or a postgraduate. Postgraduation anyhow, it is mandatory, but
Yes.
it should be driven from the student. So there are enough mentors. Anywhere you go, there will be always enough mentors. It would take that extra effort from the student, and it's not difficult to be done. We are very, very, everybody in every possible institution, the faculty would always be interested in helping out the students. So it's always the student-driven thing. Maybe sometimes you might require a little fine tuning, a little skills have to be improved on, but it's not difficult to do it. So that's how the research is. And the most important point is collaboration. That's something which is difficult at an undergraduate level, possibly. But when you're a postgraduate or maybe a faculty later, you can collaborate. You can collaborate with the other institutes. You can collaborate nationally, internationally, and to publish in high impact journals. Like Lancet and BMJ and all those things requires collaboration. So only the collaborative articles do get published in those points that is there.
Yes, sir. So also, you said that you like surgery a lot and you were under Sriram, but do you have any moments with sir that may have shaped you during your MBBS time?
I think I was posted with him twice, I think, in my undergraduate times, and sir would always teach. Sir would always teach anything in the surgical ward or maybe the surgical ICU. Anytime, any point, he'll be always teaching only. So what happened was, possibly, I think I very well remember in the exams. I think what I had my exams, I think, in the first set of, and sir was not the examiner for that set. So I was with one of the stricter examiners. So the person who was supposed to be knowing to fail everybody or something. And supposedly I did well. I think I got varicose veins and breast, I think thyroid or something like that. And I did really well in that. And that internal examiner went on to say that yes, there was some student who did well, Anta, but the marks was almost around just 65 to 70%. That's the maximum mark. So then Sarbi sir asked who was that. Then he said that boy, Anta. Then he said if it was on my day, I would have given him 100. I would have given a much higher mark. So sir keeps still saying that yes, I should have been on your day for exam. And sir was pretty well shocked when I took up medicine. So he always knew that I would want to take surgery. He was pretty shocked that I took up medicine rather than surgery. So that he still keeps saying. So that's been like that.
Yes, sir. So if you had to ask, like, you're not, as you said, you don't know how did you decide your specialty, but one factor, like you told, you were so good in surgery. What made up your mind that you are good at, you leave and you'll take medicine there, because there'll be people who will be good at one thing. So what was your factor of taking medicine when it comes to the end?
Yeah, I think it's your experience, especially when you're doing. I think as a student, you don't get that much of feeling whether you want to do it. It's just you would have seen somebody, you would have maybe your parent or an uncle or somebody from your childhood you've seen who's a surgeon, and you would get the feelings that you have to be something like that. You imbibe some idol, but to actually feel it, I think it's internship when is the time. So in internship, if you would actually do work in all your departments, whichever you're going through, be it medicine, surgery, obstetrics, that's where you get the hands-on. That's where you get the hands-on whether you want to continue this or not. Many of us would like to do pediatrics, but then undergraduate pediatrics, we wouldn't get exposed to actually cases there. Once you go into the NICU and then you see all these babies with you can't even draw the blood, you can't do a cannula and all those things. That would actually be the eye opener for you to say whether you want to continue or not. Similar with obstetric gynecology, maybe you would only see some deliveries, some this one, and you would have seen gynec cases. But then when you are posted in the labor theater and then you go through this, tirelessly working 12 hours, 24 hours, seeing that's what gives you whether you want to do it or not. So the internship, if you're doing it proper, that's where you can get your actual, whether you want to do it or not. So that's where the idea comes, okay? Whether you will do well. I mean, most of us can do well in any of the fields, not that it is not difficult. It's just practice that is what makes. If you are a good surgeon, that's how much you practice more and more and more, and you'll become better in that. So it's not that somebody can only do this field, somebody cannot. Okay, physically maybe little tasking if certain, maybe orthopedics or surgical skills may require certain physical pattern, but that's not a deterrent there. Any branch of medicine can be pursued by anybody, provided you put in enough hard work that's there. But personally, I feel it's internship that's where you would actually come to know what you're good at and what you would want to pursue.
Yes, sir. So, sir, when we talk about undergraduate and postgraduate, there are a lot of differences which has been there. So, in your residency days, during your PG days, what did you expect, and what was the thing which did not go for expectation? Like, as per undergraduate, you told that yes, you loved medicine. So, when you stepped into PG, did that really meet your expectation, or what did you do if you did not?
Yeah, post-graduation is more self-driven. That's something that you have to always remember. Undergraduation is more, you require self-driven, the nature has to remain there. But there you know that somebody is going to tell you this is right, this is how it is going to be in an undergraduate time. Post-graduation, it's all about you. You are the one who are going to see the patient, you are going to assess the patient, and based on what you assess and how do you inform your seniors or the faculty, that's how the treatment is going on. If you miss on something, you're going to have a problem with the patient's life sometimes. So it becomes more responsible there. So post-graduation is a very, very responsible post, be it even the new coming postgraduate or up till the final year postgraduate. Later also, it's a very, very responsible thing. So it's not only the knowledge that you have, it is not only the skill that you have there, it's the timely. How do you assess the patient? How do you know things are going bad? How do you know that this is going to be bad, this patient has to be shifted to the ICU? All those things are it's all dependent on your assessment. So you are primary there. There is no there is no curriculum that this is fixed. In an undergraduate, we know this is the textbook that we have to read this much. If you know, this is the questions are going to come there. In post-graduation, there's no limit. There are hundreds of books, each, if you see medicine, you have neurology, there are separate books, cardiology, every field has it. So there's no limit for learning in post-graduation. And it's not only that you're going to learn a subject there, you have to, patient care has to be done. You have to improve on your communication skills. In surgical, you'll have to improve on your skills of performance of surgeries. So there are multiple things that happen. It's not just a theoretical knowledge that is there. Many a times we hardly get any time to read theory, maybe unless you're in the final years, that's when you start reading there. So there's a lot more than undergraduation here. It is limitless. So you have a wide variety. You can read any amount of time. You can practice any amount of skill. You can learn, unlearn, and again. But very importantly, what comes to you is the responsibility of patient care that is directly related to you. So you become more crucial and critical there. It's not only the disease that you're dealing, it's the treatment that is guided based on what your knowledge is. So it requires that much of dedication from a postgraduate side that they are responsible for that patient. So that's something that is hugely different from an undergraduate. Undergraduate, you just see a patient and then leave. Here, you are the one. So you are the one who are going to treat the patient, and based on what you do, the patient is going to survive or not. So it's a very big responsibility, a huge responsibility versus an undergraduate from a postgraduate that is there. Also, you are having other things like a mandatory research. The thesis has to be done. So that would take a large number of time. You would not have that much of free time possibly as you had in an undergraduation. And yes, you would be always engaged. So there's nothing like 6 hours or 8 hours a day. You will be in hospital 24 hours. That's there. So you should be able to have that mindset that you're related to the patient, and the patient care depends primarily on you there. And that's how post-graduation is a post of responsibility. That's something very, very important. Undergraduates are also responsible, but then post-graduation is it's crucial. It's the patient's life is what you are. So whether you have a good assessment of the patient, whether you are able to identify the things that are going on with the patient, that's going to be life and death for the patient. So that's a very, very important responsibility that comes. And as you become senior in the post-graduation, you become more confident, and the knowledge adds up, so you can manage better. So post-graduation is always about responsibility and patient care that is there.
Yes, sir. So, sir, when you look back, as medical students, is there any one quality or factor which we should focus more on that will help us during our residency days, that's the PG days?
So something that has to always remember in the field of medicine when we are dealing with patients, something that we should always remember as undergraduates or postgraduates is the patient is our teacher. So what we learn maximum is from the patient. So patient is suffering, he's having a disease that is there, and that disease is what we are learning. We are learning from somebody's suffering. So that is the most important cornerstone of medicine. Patients are our teachers, and we learn whatever based on what the patient is suffering. And our intention in this process has to be absolutely sincere in our learning. We should do our best to, tender the care to the patient. The disease sometimes may be incurable. So disease sometimes might be curable. You might have a surgical resection of something and you have complete cure that comes. But many a times it could be just supportive care that we are giving. So we should be aware that there is nothing like all and none there. Diseases have a natural histories. Diseases will have, they may not behave the similar in the same patient just because I know that a particular disease goes through a normal course, that something may not happen there. But it may always change. So something that we should always remember is our primary responsibility to the patient. What we have to respect the responsibility, that's where we are learning from. Also, utmost sincerity to our work, be it the knowledge that we acquire theoretically, the skills that we do practically, the communication that we do, the treatment that we do, we have to do with utmost sincerity. So many a times it may happen, the disease might be like that, or our assessment might go wrong and we might lose patients. But that is a part of our process. It cannot be that all and run. Sometimes you would lose patients despite the best that we could do. But as long as we are sincere in our effort and we have the concern of being focused to the patient primary focus is always towards the patient, I think that's where we can do our job. Whether it ends up good or ends up bad, that's the simple motto that all postgraduates should be having it. A sincere approach with patient-centric nature. So that's something that is primary.
Yes, sir, that's true, sir. So when we come to your books, sir, you have written almost 5, 6 books now. So what actually inspired you to write the An Insider's Guide to Clinical Medicine? If you could take us to the process of how you started writing the book, and what did you feel when it got published for the first time?
No, I think that's a nice question, but I think from undergraduate time itself, I had a habit of making notes. So I still have my, full-fledged surgical notes I have, which goes to around 1,000 pages those days. I used to make notes from the time SRB sir's book had not come. So the book was not there that time. We had only his notes. I used to make notes from, Bailey and Love and some other books together. So I have a handwritten notes of surgery. So which later I had to give up because I can't publish that anymore because I changed the brand there. So I used to always make notes. So anything if I would read, I would always make notes. So that's something very important that I used to always say, that whenever you read, if you write and read, it remains in your attention much more than compared to just reading. So if I go to the library and I open a book, I would just not read a book. I would just make some notes. I wouldn't copy the same thing, but I would make notes. So something that has always been remembered. So pages and pages. Okay, when I finished my post graduation, I had pages and pages together. A cupboard full of notes that I had written. Possibly I wouldn't have read it again. Once I made the notes and it's kept there, I also wouldn't know that it's existing. Maybe only sometime later I would pick up and then say, "Oh, I knew this," and actually I'd forgotten about it. So that's how it was. So teaching has always been something which is very, very near to me. So I used to teach as an undergraduate itself, as a postgraduate, as an intern, and as a faculty also. So I used to take a lot of classes and students would make notes of it. So maybe in the first 2 or 3 years, I would the entire notes of my practical classes, what's come out as an insider's guide, every system I used to teach, for 4 months, 3 months, multiple times I used to teach, and students used to make notes of it. So that was there, and they would Xerox it and circulate it to the next batches. So practically there was an insider's guide, though it was not named under me there, but it was in circulation. So quite a large number of that was there. Way back in 2011 or 12, I think one of the senior faculties just mentioned, "Why don't you write?" Okay, just like that. He said, "Why don't you write?" He knew the publisher. So then I said, "Okay, we'll do it." Anta. So I think within 2 months, the publishers came in contact with me and they wanted a theory textbook. Theory textbook is what they wanted. They didn't want the clinical. I always wanted, because clinical, I already had my notes. So I thought it would be easier to me. That was handwritten notes. But then what the publisher wanted, no, clinical books are already, they had some other. So they wanted me to write a theory book. That's where the first edition of exam preparatory manual came. So started work in 2012. And for almost 3 years, I wrote only one chapter. 3 years I took just to write one chapter. I was pretty lazy, if I would say so. But then, maybe in the next 2 years, I wrote another 3 chapters. That's all. But then in the last 6 months, when the book got published in 2016, in the last 6 months, I completed the entire book. So that's when the first book came up, I think exactly somewhere in the month of November, December of 2016. That's the first edition of exam preparatory manual. Very, very simple book it was. And the publisher said, "Okay, we will release it." And to the goodness, it was received well. It was received very well. The copies got sold really well. And I think within 2 or 3 months, they had to reprint the book. And then the publishers themselves was very, very excited about the project. And then it went on well. And again, within 2 years, they wanted a second edition of that. So in 2018, the second edition of the theory book came out, which was much refined and revised. And that's when I said, "Okay, now you know that the book is selling. I want to get my clinical book out." So that's when they agreed. Otherwise, I had my content, but the clinical book was always very near and dear to me. So that's when I asked, "No, I want this clinical book." So that's when they agreed. And I think in flat 4 months, I think, again, since my notes was already there, Dr. Anudeep, who was my postgraduate from 2016 batch. So I think for my birthday, he had, cyclostyled it and given a rough copy of it, typed himself, had typed all the notes, rough copy of it. So I told him, "Okay, once you finish your post graduation, we'll sit together and make a book out of it." And for 3 months, me and Anudeep did sit together, and then we typed it, compiled it, and I think in 2019, mid of 2019, Insider's Guides came, and I think I knew that the book was good because that's something which was my forte, clinical medicine, and it clicked really well. It clicked really well, so that book became a hit. So after that, I think there's been no seeing till now. I think putting together all editions, 23 books in less than 9 years. So that's something big that is, I feel it has happened. After that, it was not difficult. Every edition that came, I had very good students under my postgraduate students who were collaborating with me. And every chapter in the book is not only written by me, it is compiled by them. So if I feel that a new edition is needed, so I know around 20-25 of my postgraduate students who are specializing in various subjects, I just send the chapter to them, and then they would put their inputs, and they are contributing author to my book. So that's what has kept the books going. It's not only the content that I've had, but all my students who have contributed to that till now, they have enhanced it. And I think in way back in 2019, that's when the Washington Manual, that was a very surprising thing. I never knew that. Once I got a mail, I was taking a class and I got a mail saying from the Washington Manual editor that they're looking for the South Asian edition of it. So I thought it was some prank or something. Then I mailed them back saying, are you sure that you want me to do it? They said, yes, we would like you to do it. So then Washington Manual happened. Washington Manual is a, it's like a gold standard thing. As postgraduates, we used to carry it in our pocket. So every medicine PG has to carry a Washington Manual. So it's something like a Bible for medicine PG. So, from 2006 to 8, where I used to carry a Washington Manual, by 2020, I was editing it. So something that was big. And then the other books happened, the MRCP book, the ECG book, etc. happened. And then luckily the Washington Manual also did well. So I got the second edition also of that. So it's been a collaborative effort. Yes, I did put a lot of effort in the beginning, but later I think I did, the students who have been with me have helped me right through. So that's how the books and the journey of books went on. And then there was a demand for more. There is still a demand of many other books. I'm very sure maybe in the next year or so, we will have more books. So it's a big effort. It takes a lot of time. It takes a lot of, you have to compile, you have to do a thing. But then I have had my good team that has been there, which has helped me do that. So it's not my effort alone. It's the effort of all my students, which is seeing what the world is seeing today and crediting me, but it's the credit to all of them.
Yes, sir. Yes, sir. If one were to go to your Instagram and see that, we can see more than your photos, your students are being tagged, you have posted them more. So what drives you to be so teacher friendly? Because once when you ask your students, the first thing is that sir is so friendly that we can go and approach anything we want. So why do you actually keep the teaching so friendly, student friendly?
I think I had good teachers. So I had good teachers who would always, if I had a doubt or something, I would include all the seniors. Okay, even my seniors who were there in post-graduation were very good teachers. So they are the ones who taught me what is this. If this is a question asked for you, this should be the answer. It may not be given in books. Now possibly my book has come, so the answers are there in the book. But medicine is so vast that the teachers would know so many things from so many books. A student would possibly not be able to find it. So now there is no reason. All the answers are there, which are going to be asked by a teacher, would be there in my book. So we didn't have such books that time. So it's always something that is there that I have been taught. So I have been told, had good teachers who have told me this is how the answer for this question is like this. If you look into like this, so they have guided me well. And I always felt that yes, what is the knowledge that I have should not go away with me. So it should be there. It should remain. And whatever benefit, book doing well, book not doing well, that's secondary. But whatever knowledge I have had through my seniors and whatever I have experienced and read should remain for the next generation. So that's something very important. It's not about knowing it and then practicing it on your own. It should go to the next. So I could teach a very small group of students who are possibly under me. It's not that entire students I can teach, but the books goes everywhere. The books goes everywhere. The videos or whatever, they goes everywhere. So I would teach, many more students without myself being there. So that's the motivation that goes. So if at all I have something within me, the knowledge that I have got, I have been given by my seniors, by my teachers. I think it is my responsibility to some format that it remains helpful for the next generation. So that's what is driving. I'm not sure of the fact whether I'm very student friendly or not, but yes, if anybody comes and asks me a doubt or anything, I am always available for that.
Yes, sir. You had mentioned that you had writing a book, you are teaching, you are a doctor physician at KMC Manipal. So how do you maintain this work-life balance as a doctor, teacher, and author?
I know it is difficult because yes, we can't do everything. We can't be, everything requires its time. Patient care requires its time. Your teaching, the fixed teaching schedules that we have, that requires its own time. And then writing takes time. So, and we have 24 hours in a day only. So that is a fixed time that is there. So actually, if you ask me, I don't know how I'm able to do that. If I would come to know how it's happening, maybe I would be able to answer it better. But yes, there is a timing that is needed, that yes, you would dedicate this many hours, maybe 2 hours or 3 hours a day for this particular event, maybe a research writing, a research paper, reading, because writing is just not compiling. You have to know whether what you're writing is true or not. You can't just keep writing just because this is my experience. I can't write that. I'm writing medicine. I'm not writing fiction. So it has to be counter checked. It has to be verified. Only then written. So it takes a lot of thing when we add a new things. Once the book is already there, the theory book is in the 5th edition, the practical book is in the 3rd edition. Now, when we make changes in that, we have to be very clear that this point is actually there. I can't just write, colloquial medicine. I have to write scientific medicine that is there. So it takes a lot of time in understanding it. But as I told you in the beginning itself, that I have had wonderful students of mine who have aided me in this. They would do the proofreading, they would do the adding, all those points, they would do it. And anytime, any book, I think, I get mails every day practically by students from various parts saying that this is a print mistake in this. Sir, we could not understand this part of this, whether you meant this or whether you meant something else. So there are always queries that keep coming. So whenever a question is asked, we would generally go back and then possibly we look at whether what we have written, what our intention, what did the sentence mean? Do we have to change that sentence so that it helps the student understand it better? So it's a continuous process. Just because my book is released today doesn't mean that the book is end. I will have to make sure that everything in that book is proper. So when the time comes for the next edition, we have a good amount of changes that are there, which are there in the mind. So it's a continuous process. It requires time. Definitely, that's something that is there. It requires dedication and a team effort. So there is nothing other than the team. So if my team has worked, and that's how the books have come up this well. If I did not have a team, possibly I wouldn't have had even a single book in this year. So it requires, you require to give responsibility to everybody. Most of my books are collaborations. Almost all my books have more than 20 co-authors who have been there, and many of them are, the main authors also of the book. So it's how much you give, that much your book gets it. So it's a continued approach. So it's not just one time. Uh, you have to be in the continuous part, and yes, time management is important. You will have to have your time for everything. So you will have to, compartmentalize, and maybe I don't practice that much. I do clinical practice in the wards and all those things. I don't see much patients. I have a fixed amount of appointments I see. So I do a little less of that. I do more of books and research, maybe more. So it requires time. You can't do everything. Everybody can't do everything.
Yes. Yes, sir. So you might have seen many thousands of doctors, thousands of students under you. So what do you believe is the one quality that every doctor must cultivate himself?
Yeah, I think that's something which I always mention: sincerity. You should be sincere to yourself. You are to sincere to the patient, sincere to the profession. So there is nothing that you don't know everything. When you start, you will not be expected to know everything. It's a process that we learn. So many years later, after 20 years of practice, even I am learning now. My knowledge when I passed a postgraduate 17 years back to the knowledge that I have at present is almost 80% of what I've learned is after passing. So it's very important for us to understand that we don't know everything. And science, medicine as a science is changing every day. What we have been practicing earlier will change. So it's very important that we have to remember sincerely that our knowledge is limited. So if we know that, we will continue to progress. So many times we would not understand a pathophysiology of a disease or what's happening with the patient. And many times to cover that, people would lie. That's something which is something should not be done. If you do not know it, you do not know it. You can ask for help, you can read about it, you can take help from your seniors or your faculty there. But what is important is we should not lie. Sincerity is something that we have to be there. Sincerity to the profession, sincerity to ourselves, sincere to the profession, sincerity to the juniors, what we are there. So that is some quality that all of us should have, that we have to remain sincere to whatever. So whatever is the end result is patient centric. So by us lying something or just whiling away, as if something doesn't happen to that, that's something which we should not do in this profession, because whatever we do, finally the end result is patient care or the patient related things that are going to happen. So if we work with utmost sincerity, knowledge will come. Knowledge will come and there will be people. And if you are sincere, people will help you. So your seniors will help you, your juniors will help you, everybody is going to help you. And if you have your sincere attitude to your patient, the patient himself is going to help you. So sincerity is something you have to imbibe and you have to continue to do that. Many times you will not get, you do all the work and you don't get, people don't recognize it. People do not, they may see, okay, still they may find out some mistakes of you when you've done 100 things right. One mistake of yours might be highlighted, but that's part of it. That does not mean what you've been doing is wrong. So you have to continue whatever you're doing sincerely. So that process of yours, if it continues, everything else will fall in place. If you're teaching, do it sincerely.
Yes,
if you're writing something, do it sincerely. If you're doing a research, do it sincerely. Do not, the data, everything, do it sincerely. And that's what is going to. Many times our research don't get published, does not mean their work is bad, right? So whatever you do it with sincerity. Eventually it will get you where you want to go.
Yes, sir. So, sir, you have completed many years in medicine. So, what is the legacy that you hope to leave behind in the field? What do you want people to remember you as?
I don't know. I don't know what the people would remember me as. I think as of now, they remember me as a author, maybe that's all. Or he has written a good book, which we have followed. So maybe a good teacher, a good person who taught us something. So that's something that I would be. And maybe he was human enough. Okay, maybe that's what. Things will change. There have been bigger books when we were there. We had big books which were there, which we followed. Now the generation is following my books. 10 years from now, there'll be a new set of books that is going to come. Or with this AI coming, I don't think so books will be read anymore. People would all depend on, the artificial intelligence and things like that. So what I think important point that people would remember, I wish people to remember me is that I did during the process wherever I was in control of things, I did do a good job in whatever I did, maybe writing books or teaching. So if they remember me as that, that should be sufficient.
Yes, sir. So, I think we have discussed much enough, so we can open the questions to audience. Like so many people will be excited to interact with you. So, if anyone has a question, they can switch on their video and they can ask directly. If anybody has a question, they can just mute themselves and switch on your video and please ask the question.
Hello, am I audible?
Yes, you are audible. Just please introduce yourself and then we can ask.
A very good afternoon, sir. I'm Sophia. I'm the secretary of ESIC SIGN. I have a question. How can we manage academics along with extracurricular activities? Like how many hours of the day would you usually give during MBBS years for PG preparation or even for, you know, exam preparation as such?
Yeah, that's a good question. I think, see, primary motive once we join a professional course, MBBS or whatever, is to finish that. So our primary motto is towards the subject. We are joined the MBBS, we want to finish this number of subjects every year and finally finish it in the 4, 5.5 years, whatever we have to finish that. So our primary motive has to be there. Many of us, our learning capacities, our understanding capacities, our capacity to keep information is varying. Some of us would understand by one reading possibly. Some of them would require more and more reading. So it's individualized, right? So somebody who is extremely good at, what we call it as you read it once and they remember it ever, they possibly won't require that much of time in, reading it again and again. But on the average, people would require maybe if you would, you have a full day of yours from morning 9 to evening 5, you will be in your classes. So that's obviously academics that is there. So that much of portion of your time is going to go to academics. And after that, maybe you'll have a 5 to 6 hours that is there before you go to sleep. How much of that 5 to 6 hours do you want to give for academics? Actually, it is individualized, based on the subjects. Maybe some years you have a lesser subjects, possibly you would require maybe 2 to 3 hours a day, and the rest of the time you can give it for extracurricular. Sometimes there are events and etc. Your full day will go to extracurricular. If you go into some sport or culturals, etc., there may be days of your entire, or sometimes months together, you might go up spending in extracurricular. So that backlog of your studies would come. So everything requires to be balanced. I wouldn't say that every day you have to read for 2 hours, 3 hours, or something like that. What we have to remember is do it consistently. What I would always say is, it's like a marathon. It's not like a sprint. Your exam that is there, it has to be, you have to do it every day. Only then it will end up in your finals. So even if you are reading to 20 minutes in a day, read that 20 minutes very, very fruitful. Do not just read it for sake of reading it. The 20 minutes, if you are spending in a day for reading, read absolutely good there. So that 20 minutes, you don't have to repeat it. Some days you can read 3 hours, some days you can read maybe Sundays or week offs, weekends, you can read for 4 hours or 5 hours maybe. And the rest of the time you would want to give it for extracurricular. So it is very important for us to know that it is not a fixed schedule. Yes, we have to finish our portions. We know that this much of portion of medicine has to be finished before your theory. So you have to plan it that if some days you're not able to do it, that has to be recouped in the next day. So it is a long process. There is no hard, fast rules for it. But what is very important is remain consistent. Do it daily. And yes, do focus on your extracurriculars, but it is required to maintain your good health. You're required to be active in your sports. So you would want to give maybe 2 to 3 hours a day for sport or extracurricular. But the rest of it, as I told you, once you have joined a professional course, our primary goal is to finish the professional course well. So a majority of us should be concerned with that. So that is something that is there, and it has to be consistent. You can't read medicine alone when you come into final year. You will have to start reading medicine right from your second year itself. You start reading smaller and smaller topics, and that would remain with you in the final year. So, the medicine process itself is a marathon. It's not a sprint. You can't do it in the last moment. So you have to plan it right from the beginning. So based on how good a grasper you are, how good a learner you are, the time needed might be different, but it has to be very much individualized. But read daily. That's something which I would always advise. Even if you can read 20 minutes in a day, that may not suffice, but please root that 20 minutes you give for reading. And then you can keep increasing. Hope I am able to answer that question.
Thank you so much, sir.
Yeah.
We can take a few more questions if sir is okay. I think some of us also want to ask. Because the time which I told was 4 to 5. So if sir is okay,
No,
we can take a few more questions.
You can ask questions.
Can I ask I'm not here to ask a question. Sir, I am an old student from KMC Mangalore. because you are coming for the talk, so I thought I should listen.
Hello. You are Aishwarya, right? Yeah.
Yes, sir. Yes, sir.
It's
You have taught
nice.
me X-ray and also I clearly remember that. I saw this in one of the students' status update and I was like, "Hey, this is my sir. I know, sir." So I was like, "No, I'm going to attend this."
Nice of you to do that. It's nice seeing you again.
Thanks a lot, sir. You taught so much of medicine. And I was very fortunate. All the names you're taking, SRB, sir, everyone. So it was like a walk through the memory lane.
Thank you.
Okay, sir.
All the best.
Thank you.
Hello, sir. I am Umesh from third year MBBS, and I wanted to ask you, sir, that medicine feels very vast, and MBBS also is very vast. So there are some mistakes which happen unknowingly or knowingly. So how did you tackle them, sir? Because when a subject feels vast, we try to do some things to just cover it up, but we miss a lot of things. So
No, that's true. Medicine is vast. You can never finish it. Maybe I can also, even after so many years, I can still say that I have not finished reading medicine. So as far as you know that that's a mistake that's been done once or something related to a particular subject or something maybe, and you know that it's a mistake and you do not repeat it again, that should be fine. As far as you correct it and you possibly go back and read about it and do not repeat it, that should be fine. Medicine gives us that much of leverage. So it is not an all or none. It's impossible to know everything. We have made mistakes. I have made mistakes. I have made mistakes. We continue to make. That's something which is a thing of medicine, that things keep changing. What was a rule earlier, what was a drug, the dosage which was there earlier, now it is not supposed to be given like that. If we are not updated, we do end up doing mistakes, and maybe we try in front of our juniors who would know it properly, we would like it will be like pretty foolish. But as long as you know it, you understand it's a mistake, accept the mistake and correct it, do not repeat it, that should be absolutely fine.
thanks, sir.
Hi, good evening, sir.
Good evening.
I'm a first year, and I was wondering when you should start like your PG preparation, because right now we're kind of like only focused on like university exams. Is PG something we have to worry about like right now, or is it only for like fourth year?
Whatever is going to be asked for you in your PG exams is basically what you have gone through all these subjects. So if you are doing your subjects now, the MCQs from that is only going to be asked in your NEET exam that's going to come after 4 years. So as far as your basics, your anatomy, biochemistry, physiology is very sound, you read it really well. You will take much lesser time to read it again once you prepare in your preparation time. So what I would always advise, I know there is a lot of there are a lot of avenues that are available who will take classes from first year itself. Various coaching forums are there where they coach you for NEET PG now itself. People would miss the clinics, people would miss the classes in the regular classes and go for that. I wouldn't advise for that. It's very important that you remain sound in your understanding of these subjects and you're giving your exams. Anatomy, physiology, biochemistry, your pathology, pharmacology, very important these 5 subjects are. If your understanding of that subject is very, very good, once you go into the preparation mode, it will be very easy for you to redo it. So please concentrate on your subjects. Yes, if you have time, read the multiple choice questions which you have books available for your preparations. You don't have to go for the classes. You can read the multiple choice questions which are there. You have books available for it. So go through that. That's absolutely fine. The learning is always yours here. Do not indulge in parallelly doing medicine and preparing for super specialty, your PGs. At least even I would not even agree to do it in 4th year. I would say it should be internship only. That's when you would want to do it. But yes, maybe the 4th year you can concentrate a little more. But till then, please concentrate on your subjects. Do self-study. There are enough of books, there are enough of material that's available, which will help you to solidify your knowledge for the NEET PG. Because all your NEET PG is going to be primarily based on the knowledge that you learn in the individual subjects. So read the subjects well, prepare for the multiple choice questions or whatever pattern that is there. We don't know when it comes later, when you become final years, what is the pattern of exams that is going to come, whether your next is going to come and your entire MCQs is going to be abolished. It might be just your practical marks and then a centralized exam that's going to come. So please concentrate on your subjects. Parallelly, on your own, prepare for NEET by looking into books or material. I would not advise you to too much spend time on these, at least in the first 3 years of your MBBS.
Okay, thank you, sir.
Thank you.
Good evening, sir. My name is Manasvi. I'm in first year.
Yes.
It was really nice listening to you, sir. So I did listen to whatever you told, and I was just curious. If you were to do MBBS again, if you were to do it from the start, would you do something like differently, like from what you're told right now?
Maybe I would have taken up surgery. That might be the only change, but I don't know. I've been maybe good in medicine. I would have continued medicine. I don't think so. I would change much. But yes, the worry that I had that I may not be able to do surgery because of my tremors. I know 20 years from now, my tremors are not worsened. So they are practically not there. So maybe it was a unnecessary worry at that time, but maybe that is what destined that I had to switch to medicine. I wouldn't change much.
Okay, sir. Thank you, sir.
Hello, sir. I'm Chirian. I'm first year MBBS, and I want to ask you that what is the one thing I should need to remember throughout my medical journey?
Yeah, that's what I told that time. So what you have to remember is your primary learning is from others. It's not the books alone. It's the patients, it's your seniors, it's your teachers. So there's so much of thing that you can learn from the patient. So always remember your entire process has to be patient-centric. When you're reading something, you should know how this has to be applied to the patient. When you read a drug in pharmacology, when you read about the side effects, you should know that when you give a drug to somebody, they can develop these side effects. So when you read in that way, patient-centric way, you will always be reading it better. You will be able to understand it better. So always remember, patients are our main teachers. So they will teach you everything, and you learn only from them. So if you remember that, obviously nothing else is needed. Yes, obviously you have to read, because medicine, you have to know so many things. You'll have to learn so many diseases and all those things, but always keep the context of the clinical part of it. Patient-centric context for every disease or every subject is learned. That will help you in a big way.
Thank you, sir.
Thank you. Thank you.
I think we can take one more question because time is already running.
Hi, sir. I'm Anton Charles. It's truly inspiring to even see and talk to you, sir. Sir, you talked about you being the first generation doctor in your family, right, sir? So, in my family, even I am the first generation doctor, first generation graduate to be precise. So, in my class or college, there are people who are my colleagues or my classmates whose parents are already doctors or accomplished. So there is this certain level of peer pressure that exists. So was it the same at your time? And if so, how did you tackle it, sir?
Definitely. I think our time it was much more, because that time doctors' sons and daughters were doctors only. Now at least there are doctors' sons and daughters who do. There are other avenues which have come, and then the field of medicine is not so lucrative maybe compared to what it was those times. That time practically every other student had a parent. Some of them had two parents, and some of them had generations together who had doctors. So it's always going to be there. There is nothing. And there have been so many in our batch, my batchmates also, who are first generation, the first time we did it. So it's not a hard and fast rule. I personally believe it is more pressure on them, because if their parents have already accomplished, It's not about just finishing your MBBS and then you have to continue their legacy. You, as a first generation, you are going to form your legacy. So I feel it is easy for you. You will form whatever you want to be. Your children might have to continue that. But for the people who are, parents are doctors and all, they have a lot of more burden once they pass out, because they have to continue the legacy. If it does not, if they're not able to do that, yes, they may have the facilities which are available for them. They can go back and practice and all. But on the long run, it will be more pressure on them rather than us. Yes, the peer pressure during your curriculum, during your study time is real, and it's something that we have to live with. But I don't think so. It should be taken as a disadvantage. It is you are creating a niche for yourself. You don't have to follow somebody. That is something unique for a first generation doctor, if at all, because you're going to create what is maybe followed in the future. I don't know whether your kids, you would allow them to do medicine, but you're creating something for yourself. You don't have to be following somebody else. So it's a big advantage, I personally feel. But yes, the pressures of that is real, and it is going to be there. So we can't undo that.
Thank you, sir. Thank you so much.
Thank you.
Does anybody else have a question, or should we wrap it up?
Good evening, sir. Kanishka Verma this side. Sir, MBBS and medicine, very vast things, right? There would have been moments wherein your lows become your lowest. So how do you pull yourself out of those moments?
So main point here is we have to keep going. So our focus is going to be for finishing it. Once we have joined a particular course, be it MBBS, be it MD later, we have to finish it because we have taken a choice of doing that. Many times we will not be able to be, reach that 60% or 70% that is expected for us, which is natural, humanly natural. And the lows does not mean it always remains lows. There can be lows, there can be highs, and that is going to be there. The process has to continue. So we require to have a good peer group that is there, which will help us make sure that we don't go the low into further low. It's very important that we remain interactive with our students, with our colleagues, with our hostel mates, etc. Yes, you might fail sometime. You may not get the marks well. You may not be performing up to the level. You might make mistakes, but that's known. Medicine is known to do that. You have to move forwards. We have to look at what is going to be the final course. So we have to finish it. And since we have taken it as an option, we have chosen to do that. Yes, we have to continue doing it. And most important thing that helps us in our lows is our peer group that we have. So whenever you have a low, make sure that you discuss it out. Do not keep it to yourself. Now, many of our times we would not discuss with ourselves. We only celebrate our victories. We don't speak about our weaknesses or something. That's something that you should give up. It is good to speak about somebody's weakness. It is good to speak about feeling low, because that is what helps us to understand. You're true to yourself. You know what is a shortcoming. Obviously, a solution will come. One of your peers will get a solution for it, and one of your peers will help you to come out very, very easily. It's much easier when others help rather than doing it on your own.
Thank you, sir.
Thank you.
Thank you so much, sir, for sharing your experience and wisdom with us today. I'm sure every student feels more inspired and a lot more confident after listening to you. And sir, you made such a great point. Yes, we do need each other to bounce back from the burnouts and disappointments, grow and evolve and to move forward. A healthy environment is indeed needed for the basis of a healthy competition and research. And also, a big thank you to our organizing team for organizing this event smoothly and successfully. And of course, thank you to all the participants who joined us today and made this event meaningful. This is Sophia Mandal, Secretary of ESIC SIGN, Student Interest Group of Neurology, under American Academy of Neurology, signing off. Until next time, keep questioning, keep learning, and keep that spark of medicine alive. I would request the participants to not leave the meeting right now. Kindly turn on your cameras so we can click one picture of all of us gathered here. Thank you. Please turn on your cameras, everybody.
So I would like to once again thank sir for, I think contacting you was much more exciting for me. Just putting a hello on LinkedIn, I didn't expect you to reply actually to that message. Thank you for replying to the message and coming to us. So we also expect that we can also meet you once when we come to KMC. So we are also looking forward to that. Thank you, sir, for coming and addressing us.
Thank you
Thanks a
very
lot,
much.
sir.
Thank you. Thank you. All the best.
Okay, sir. Thanks.
Thank you so much, sir.
Thank you.